Hey everyone, hey IMGs. I'm coming on live because I want to talk about experience types today. And this week I'll be giving you some information, mostly extrapolated from AMC and their prior studies of prior application cycles. So following applicants from prior cycles. So for experience type, you have several categories. And I'm going over this because I've received so many questions about, is this an appropriate experience? Is this an appropriate experience? So the first thing, education and training. That can include clerkship. So if you are a Caribbean medical student and you did some rotations and one of them stood out, let's say you're going into neuro and your neuro rotation really stood out to you or was meaningful to you, you can write about that. Or if you did an acting internship or an away rotation, you can also consider writing about that. Sub-internship, so that's where you work within a residency program, sort of as if you are an intern. Most of us do that to audition ourselves or to show ourselves to residency programs that we're eligible candidates or they should consider us. Or they even add structured observerships as an example, okay? And by structured observerships, this is for my IMGs that are already graduates who have come to the US for 1, 2, 3, or 4 months in an observership setting. This is where you can capture one of those experiences, and provided it had structure to it. So there was a formal setting. A setting could be an environment. So the setting could be a clinic, a hospital, an ICU, a nursing home, a long-term acute care facility. Those are the contexts, right, that you did your structured observership in. So for experience types, when it comes to education, yes, you can write about one of your clerkships that stood out to you that was meaningful, one of your array rotations, one of your sub-internships, one of your observerships. That is perfectly fine. The next one is professional organizations. So this could be an organization such as the Red Cross, the Rotary Club, the Association of American Academy of Family Physicians, American College of Surgeons. It could be a professional organization that is unique to your demographic or a cultural organization that you're a part of that has healthcare impact. Remember, the most important thing of all of this, of all your selected experiences, is that they must communicate who you are and and what you're passionate about. Think about this. This is a job application for residency. So this is not a job application for, working in a corporate job, for example. So the experiences that you select, you want to make sure that they depict certain characteristics that you have that will be valuable for a program. So you need to be thinking about the program, not only about yourself, but do consider the program as much as you consider yourself. So you're writing about what you're passionate about and what's important to you in relation to the program that you desire. And remember, when you pick a key area, you want to make sure that you tie in that experience with that key area. So we talked about education and training, and we've talked about extracurriculars, professional organizations. And so that could be the Association of Indian Physicians. It could be, the Association of Caribbean Physicians, whatever it is, you were a volunteer there, you're a member, you've done 1 or 2 health relief projects with them. I think that's a great example. Another key area, they ask other extracurricular activities, clubs, and hobbies. My recommendation with this is you're not supposed to I would not recommend that you group all your hobbies under one box. I think you pick one hobby that communicates who you are and what you're passionate about. So which is the hobby that you spend the most amount of time in, the hobby that you actually have a true commitment to over a period of time? Utilize that one. Pick that one and talk about it. And so for those hobbies, it could be a sport, right? So let's say you coach high school basketball or you coach middle school football or whatever the case may be. Then you put the name of the organization that you coach within, that's your organization. And then in your description, you capture the context, coaching 3rd graders, 4th graders, 5th graders, whatever the case may be, through summer football. Okay, so it's an annual experience. That's an example. Music, you sing in a choir. Well, you can capture the choir name. So St. Andrew's Choir would be the organization that you're working with, or the choir at the Catholic Church of Basilica, whatever. That's your organization. So that would be the very organization at the top when you fill. And then you would describe your role in the choir. So maybe you sing alto, you've been on choir for 5 years, 20 years, whatever the case. That's how you portray a musical extracurricular. Theater. So maybe you're a part of the Cleveland Orchestra Theater, right? Or you're a part of the Theater for Arts or whatever, painting or something. But you have to conglomerate it into a way that it conveys commitment, it conveys dedication, it conveys that this is just not something you're pulling out of your boot, pulling out of the back of your head to just present because you think that's what they want to see, right? Now, another key area is teaching and mentoring. So if you've been a high school teacher, a teaching assistant, those of you, my Caribbean math students who were teaching assistants for MD5s, or you've come back to your school and you're teaching assistant for anatomy, physio, that's a great way to show that you have teaching as a skill, because residency is all about teaching. It's about the senior residents teaching the juniors and so on and so forth. So I think teaching and mentoring is a great way to capture that experience as an experience type. Again, the key is you want to have a structured organization that you're a part of that can be easily verifiable, and it can be reflective of your level of commitment. Volunteer service advocacy. So this is any unpaid experience in healthcare, in public health, in healthcare administration, in the business side of medicine. All these volunteer activities that you've been a part of that show your commitment. And it could be even in advocacy. Maybe you're advocating for insurance, or you're advocating for Medicare or Medicaid clients. That's a great way to portray your dedication to healthcare, right? So sometimes our volunteer is not always a medical relief trip, though it can be. It's not always volunteering at a hospital, though it can be. But it may be that you volunteered within, a Medicaid population, or a company that serves a large Medicaid population. I think that's where you want to capture it. The main thing I would think is think of an organization as structured experience. That's the key word. It must be, it must be a structured experience. That's my recommendation. Obviously, you can do what you choose to do. This is free information on the internet that I'm giving out. You don't have to follow it. But from my experience, what I've seen and what I would recommend is you identify structured experience. Service is another one. So you served in a certain role which was unpaid, but it means something to you. It shows your commitment, it shows your dedication. You've done that for years of your life. Well, do speak about that. It was an unpaid experience. It's your time that you've given up. And I think when you write about a volunteer experience or a service experience or an advocacy experience, you're talking about the time that you've invested into something that adds meaning to other people's lives. I think that's the key there, because that's what we do in medicine. We're adding meaning to people's lives. All right. Work can include paid, even non-clinical work. So your work doesn't always have to be clinical. You may have had a non-clinical role. Maybe you were an Epic trainer, or you were an expert in a certain EMR system, or you worked in IT. Business or entrepreneurial experiences are also considered as examples. And I'm getting all this information from the AMC's website. And they have given you even they've cited examples, and I'll post that tomorrow on this page for those of you who need more of a written format to kind of swipe through if you're coming in late on this live session. But you can include entrepreneurial experiences. So you owned a business, talk about it. You worked within a family business, talk about it. You worked within a non-clinical business. It doesn't only have to be clinical work. Now, another key question that I've gotten this cycle is, do I need to have 10 experiences? Must I have 10 experiences? Okay, first of all, the reason they're asking you to select up to 10 is because in the past, people would have 20, 30, and then another person would have 5, 4. And at the end of the day, the applications were not specific. They weren't driving home a message that programs wanted to see. The goal this cycle is they're trying to get the right applicant in the right program the first time. So in communicating or selecting those experiences, you do not have to select all 10 if you don't have all 10. So you don't need to fabricate an experience just because you think it would make you competitive. You don't need to do that. However, you can have 3, 4, 5, or 6, or you can have 10. You do not need to have all 10. Now, another key area that I think was very kind of interesting for me to point out was I was reading this document. It's called the 2022 AAMC Supplemental ERAS Application Evaluation of Past Experiences. It's from the AMC site. And last year, when it came to these experiences, I think from this document and my understanding of it, the mean number of experiences was 5. So that means you can have more than 5, you can have less than 5, but knowing that the mean and the life cycle for all specialties combined was 5. So you can have 6 experiences or you can have 10. The more, better. If you have all that wealth of experience behind you, that's fine. But the only reason I'm sharing this is you don't need to feel insecure because you have only 5 experiences or you have only 6 experiences. And so now you're grasping at straws, trying to create a 10th experience that does not exist. Okay. You don't need to fake it. Give what you have, portray and communicate clearly and firmly. Under experiences, another key thing I want you to consider. When you have the experiences section, they have context, roles, and responsibilities. I've been reviewing so many applications this cycle, and I see many of you are good at identifying the roles and responsibilities. And my students in the IMG roadmap have got this hands down because we've gone through our action verbs. They have a sample list of action verbs. The CVs are looking super professional. They're not speaking in the first person, so they got it pat down. But the only area that I've noticed that IMG roadmappers are a little bit struggling with is that context. So sometimes in the above boxes where you have the frequency, so it was like monthly, yearly, annually, the frequency of your experience, you also have your title, which is your organization, and you have the settings, right? But sometimes it may be worthwhile to capture the extent of that context. So using words like describing if it was a tertiary care hospital, an academic teaching hospital, a community hospital, an outpatient clinic, a long-term acute care facility, a nursing home, and then adding metrics to it, such as describing the percentage of patients that you're seeing, the number, the medians, the mean. Giving metrics that are easily understandable makes your reader have a clear understanding of the setting and environment that you're referring to. So that's it for today. If you joined in late, start from the very beginning. Tomorrow I'll come back in and we'll jump in on the primary focus areas. Thank you guys. I don't see any questions in the chat, but you can always slide in the DMs and leave us a question. Bye for now. Actually, as I started to say bye for now, I noticed some people had been waving on here. Hello guys. Hello, hello, hello. Brenda, Puneet, Pooja, Sad, Jupreet, Yasin, Shashanek, Shashi. All right. Hello, guys. Hello. I didn't know you guys were all here. Wow. Nice. All right. When I started the live, it was just me alone. But I'm happy to see you all. If you have any questions, you can ask that now. I don't see any questions in the question box. So I'll see you guys in the DMs. Thank you.